Tonight, the continuing surge of coronavirus cases creating long lines of Americans anxious to get tested.
I'm trying to get COVID tested. You can see this line that goes down pretty far, and it's still wrapped around the other side of the building.
With cars in Miami Beach backed up for blocks, nurses say families are showing up in the ER instead.
Chances are if you don't have the virus when you come in, you're being exposed to it because we have so many positive cases.
In another hotspot, Arizona, which leads the nation in new cases per capita this week, Phoenix officials activating an emergency plan to increase morgue space. New cases are skyrocketing faster now than last spring. The country's first peak in late April, 36,000 in a single day, a record that stood for nearly 2 months until June 24th, when there were more than 45,000 new cases. Since then, infections have shot up every day, tonight near 60,000. In Texas, a system straining to keep up with record hospitalizations, today surpassing 10,000 COVID patients.
Across the state of Texas, the calls for help just keep coming.
I've never seen anything like this before.
Fear is the biggest part of this disease.
Paramedics in Fort Worth stretched to their limits.
So to us, everybody that we come in contact with, we automatically treat as if they're COVID positive.
I just think that sounds exhausting.
It is. The days are longer, the weeks are longer.
Texas recording 105 COVID-19 deaths on Thursday, the state's deadliest day so far. More than 9,600 people are hospitalized with the virus statewide.
The coronavirus is spreading so rapidly across the state of Texas.
Governor Greg Abbott warning next week's numbers will be worse, ordering the suspension of elective surgeries in dozens of counties and reminding Texans to follow his statewide mask order or risk another shutdown.
The only way we can prevent Texas from being shut down is for everybody to adopt this practice of wearing a face mask.
With hundreds of Americans dying every day from COVID complications,
we see a lot of patients, and they're both young and old, that are getting very sick.
The surge in cases is flooding hospitals in hotspots like Phoenix.
We're at over 100% capacity if that's possible, but every place there's a potential bed, we have a person.
In Arizona, nearly 1 in 5 are testing positive for the virus. In Texas, where the death toll is climbing, the scene is just as grim.
You see these warehouses of people on life support machines. It's dire when you're counting how many ventilators you have left. Do you have 2 left? Do you have 6 left? That's dire.
How are hospitals dealing with the increase in cases right now? What are they going to do if this doesn't get better?
So the hospitals have already started dialing back the number of what they call elective procedures or non-emergent surgeries that can wait. That way, those ICU beds can be set aside and open for COVID-19 patients. They're also opening sections of hospitals that have been closed or converting beds that have been used for other purposes and calling in nurses from out of state. But as the ER numbers show you, is you can't just flip a switch and have those beds be open. And so although the hospitals in Houston have been saying for weeks that we can surge, we can add hundreds of ICU beds, the reality on the ground is that's taking time. And in the meantime, it's creating this log jam of patients coming in the door, and that backs up into the city's ability to respond to EMS calls. It delays everything.
Mike, earlier this week, we talked about the growing number of people in Houston dying at home because of COVID-19. Are officials and first responders worried that even more people will be afraid to come to the hospital now because of this crowding, because they think they might not be able to get a bed?
They are. And candidly, their message is, look, we are busy. It's going to be different than your normal ER experience, probably. Frankly, the candid message from a hospital executive I spoke to at one of Houston's largest hospital systems was, look, we are going to keep caring for patients. We're going to keep expanding beds. We're going to keep doing everything we can. But there's a limit. And if things don't change, if these cases continue to grow as they have been for weeks, then we're going to be looking at another situation like New York was looking at in March and April, and the hospitals will run out of the ability to add capacity. You know, they're adding capacity now, and it's slow and it's taking time, but at least they're making room for everybody. But there's a limit, and they're afraid that within a few weeks they might hit that.
I want you to talk to me a little bit about what overwhelming the hospitals means. In Broward and Palm Beach County, hospitals are at 83% and 73% of capacity, and all but a handful say that their intensive care units are at or near capacity. The reason I ask you to tell me what this means is because for people who think they're not going to get COVID, emergency rooms and ICU beds exist for everybody who gets sick in any way, in an accident, in your appendix, something goes wrong with your appendix, you need emergency care. When these ICUs are full, they're full for everybody.
That's absolutely right. It's so dire at this point where we've had to actually separate parts of our hospital. So we have 2 emergency rooms now. We have one for, as you said, appendicitis and all of those other, very, very critical issues that people come to an emergency room for. And then we have a separate emergency room strictly for COVID so that we can isolate those patients and prevent the spread. Right now, my ICU is at 187% capacity. And I'm able to do that by creating additional spaces, but it is what it is. Sooner or later, we will run out of space. So we've got to get control over this disease, and we have got to stop the spread. The good news is that about 98% of the people who come to the hospital are discharged. But if you go into an ICU, you have a 30 to 35% chance of never leaving. And so it's very serious, and we have to make sure that we're not just thinking about ourselves. Many of the young people have heard, young people are not impacted by it. But first of all, they are. We're starting to see younger people impacted and sick and in our ICUs. But more importantly, they're the ones who are spreading it to those who are most vulnerable. So there is no one who is immune from COVID. It does not discriminate against anyone.
52-year-old London Kennard was admitted 10 days ago.
By the time I got the attention, I couldn't breathe. I was weak.
At one point, he says he thought he wasn't going to make it and called his family.
Told him I love him, but I'm actually telling him goodbye.
South Carolina is seeing a surge of cases, and of the more than 50,000, about 11,000 are people under 30.
There are 14 patients on this floor right now, 3 on ventilators, all of them intensive care. ICU doctors and nurses say they have treated patients on this floor as young as 21 and as old as 105.
One of our patients that was the sickest for the longest period of time and had gone through so much. He was an otherwise healthy person, young, and still didn't survive this.
She thinks if people could see what she sees, how COVID ravages the body, they might think twice about not wearing a mask. A snapshot from the front lines of a pandemic that shows no signs of slowing down. Ellison Barber, NBC News, West Columbia, South Carolina.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.